Across Chicago's far south side, something powerful is happening. Through the Healthy Chicago Zones initiative, community-driven partnerships are working to bring resources, healing, and opportunity where they're needed most. In the moments ahead, you'll hear directly from those leading the charge, sharing real insights on what it takes to support, strengthen, and sustain their neighborhoods. 6 regions, 1 Chicago.
The name Phalanx Family Services means close-knit body of people. And that's what Phalanx is. We're a family here at Phalanx. We started off with 5 full-time employees in 2002. We now have 78 people that we're able to employ as part of Phalanx Family Services. Our main goal is to make sure people leave better than they came. One of our outstanding programs for the community has been our Hcez program, funded by the Department of Public Health. This program has enabled Phalanx to empower other community agencies on the far south side. Without this program, some of these agencies would have never been able to service their community in the capacity that they have.
I think the best strategies were the collaboration of all the leads.
Definitely getting out into the community and speaking to our residents on a one-on-one basis.
I would say our relationships with the schools, our partnerships with the schools. We are a youth-based organization, and so we are woven into the schools in the far south region in 8 different schools out this way. And I would say that Graduates Over Guns kind of highlights and deems schools as the heart of our community. This is where families gather. Our youth develop skills, they learn here, and this is a trusted core stone for them, right? This is a trusted entity for them. And so for us to be able to develop these intentional relationships with them, we had to partner with someone that they already trusted, and those are the schools.
We had some meetings with the community where we all was able to sit down at the round table and to get the input of the people in the community to say what they need versus just assuming that they need certain things. So when we had meetings with the people, that helped to bring in about the ideas of what the community actually needed. So that's the strategy that we used, the meetings, and the benefit was that their input made an impact on what we were able to do, giving them what they need versus what they wanted. What we thought they wanted.
Some of the things that I feel that have been more effective are the community events. Those events have brought out a lot of resources and gave people that space that met them where they are to have information that they can understand, as well as having us as community leads, as well as the other support staff to help them navigate and discuss with these organizations or doctors or whatever the case may be, for us to be side by side versus being in a doctor where there's only them, or being in an office where it's only them, but having a space where they can have assistance and navigating some of those spaces, as well as learning education material, and also seeing other folks engaging in these resource vendors so they're not feeling like this is something that they are doing alone. How drastic it was.
That the gap was so immense. Was that so many cared about our communities?
How much of an impact and deficit that we have from the north and the south side.
We expected barriers, ones that, were typical that you would think, ones that we were just, like, wow, big shocks. Well, the main shock was how interconnected the health barriers would be to people's personal lives and wanting to really, really pay attention to what's going on in their community. So we did lots of surveys and lots of different meetings and trying to find how we could better serve the community. And through that, a lot of the barriers were housing, health insurance, being able to provide food for their families, having sustainable jobs. And so those barriers were simple things that we didn't realize really affected, how that people would give back to the community and what the actual reasoning was for why some things weren't happening.
I was very surprised to see the mistrust that our community had for the health profession. With that being said, with us having this Hcez coming into our community, we gave them resource amongst knowledge. So that was really a big surprise for me.
What did I learn about health equity that I didn't expect to know going in? More about myself and my health. The residents opening up, telling their stories, us being able to compare notes and being transparent. Even still, today with workshops that we have with them, we've lost some of our residents. We, have residents that are facing challenges, within themselves. But like I said before, the fact that they're able to be as transparent as they are and have the resources available. We actually had one of our residents screamed and didn't know that, at some point, soon as she not responded, that she would have had an attack and, had to be stretched out with the ambulance. So the medical professional from Special Friends caught that and, encouraged her to leave right then and there. And so when she got to the hospital, they did give her the heads up that she came in the nick of time.
I had no understanding of the need because I dealt with young people and their families not in the health realm. So I learned how everything is connected. Everything, the violence, the health, the food, the housing. I did not know that. And that's because I never thought about it in that place, Well, that's what Hcez taught me. Everything is connected.
Historically, Phalanx has been a workforce development solutions agency for both youth and adults. When COVID happened, we literally catapulted into Chicago public health services. This was not an area that Phalanx not only did not do, but we never imagined us doing this work. But because we were a trusted agency in our communities, we were already providing services to community, state, city, philanthropic foundations reached out to us to say we need to address COVID in this community and we want Phalanx to be a part of that. And so here we are 5 years later in public health, an area that Phalanx never thought that we would actually be engaging community around.
Well, I've learned with health equity, it's about affording people the just opportunity to be healthy. And how do we do that? How do we get at that? So as a community organization, we were able to knock down some of those barriers and obstacles that were in the way. With the help of the Chicago Department of Public Health, with the Chicago Health Zone, we were able to afford the people that responsibility of giving them what they need to even the playing field so they can be able to reset, adjust, and move on with life.
Our community members were very appreciative of not only the focus groups that we held, but also the workshops wherein we were able to bring in resources. And those resources provided a lot of insight into what was going on in the community. But also we were grateful they were grateful actually, because some of our community residents found out that they were not in as good health as they thought they were.
When we first got in with Healthy Chicago Zone, it was brand new to us. We knew nothing about it. And what we did is we learned so much from them. They were instrumental in just guiding and directing us. And when you say names like Joyce Chapman and Tina Sanders and Chanel and Lenore and Nadi, they guided and directed us so much. We had so much experience. We've been working on disparities in our community with a couple of the hospitals and things, but nothing this grandeur like this was. And they worked with us, they held our hand, and it was very beneficial. Our community embraced it, they accepted it, and it was grand. And I appreciate them.
The people were elated. This was something that was needed in the community. We were able to meet people where they are at. They were able to stand up and say, hey, I need this information.
The response has been very positive because now they're more aware of their health than ever before. Like when we did vaccinations, some of the people had no idea about the vaccination, and then they are more aware, more healthier, more safer, more positive in certain areas based upon us providing the vaccination for them. So it's positive. It's been a very positive response.
Once we got started with this all of this, it was well received by our community. What happened is our community was just not informed. We had you name the disparity, we had it. We did a workshop, a discussion workshop on vaping and menthol. And I invited the grandparents out because, as you very well know, 60% of the people that bring the younger children to school are grandparents, not the parents. So I invited grandparents and I explained to them, you got to realize we've got to help save our future. Because although children are 35% of the population, they're 100% of our future. So grandparents came out. I had Dr. Tanya Robeson come out, and she was there. She did a PowerPoint, and she gave some jaw-dropping information. After the session was over, it ran for 2.5 hours. They wanted more. They really wanted more. The grandparents said, Miss Porter, can we have a part 2 to this? Because I'm going to bring my neighbor. I'm going to bring my aunt because they need to hear this. Because I have to inform. It's my job to inform our parents, our grandparents, so we know what we're up against. So that stood out. And then I had the next event. I had 61 at the first event. I had 93 to come out the next event. So it's working. It's well received, and they appreciate us. And I just feel good about helping my community. Somebody did die and leave me in charge.
Well, I represent the East Side community, which is different than a lot of Chicago communities because it's tight knit, and the community members have been very responsive. They especially like the series on diabetes, Real Talk. And that stood out to me because it was so many untold stories. They had so many stories to tell, aunties going to sleep and not waking up. And they had so many questions about chronic diseases and what they can do to prevent them and how could they make a change for their community, their children, and be impactful. So, the community just was very responsive.
To be honest, initially they weren't really receptive. Going in, yes, we have these great relationships with the schools and that help us foster these relationships with the community. However, when you're talking about delicate topics such as health disparities and lack of resources and things like that, they kind of tie that into the Tuskegee experiment, right? And those historical traumas. So we had to really have intentional engagement to peel back those layers of that onion, right? And what happens when you peel back layers of an onion? you cried. There were a lot of tears. And I remember going back to one of, we did a focus group around the holidays. You know, the holidays kind of bring out those emotions around people anyway. I know I am. I'm a sucker around the holiday times. And so we were talking about just different health disparities. And one was just lack of how they feel were effective healthcare in the community, and talking about high blood pressure and what that does to Black women, you know, and us being a Black women-led organization, that hit home for a lot of us, you know, there, and talking to a lot of the moms at that focus group and the different pressures that they're under and what they went going through in their individual lives and how they still show up for their children. We had a mom, young mom. She was about early 20s. She had 2 children. One of her children, her son in 1st grade, has autism, you know, and her facing those difficult, you know, stages and trying to advocate for her son, and the stress that has put on her and her family, and how quickly she had to learn the different services and who to talk to and who to email, and how those women and that focus group rallied around her was amazing. And that really stood out to me, and how a community, it is very important. A community is not a place, it is a relationship. And there they showed me really what community does and how we can show up for each other.
Focus groups.
Focus group.
Focus groups.
The focus group, it really brought us, the leads and the community, to the table for a open transparency discussion onto what to identify the needs, right? And then with that, we brought, you know, the resources and the information, and then got the partnership. So I would actually say it was our focus group to basically get the buy-in from the community.
I would say the Sunday events, the events that we held on Sunday, we had more responsive community participation. And I think it's because the community that we serve are working people. They normally work, you know, labor jobs, construction, and they work a lot of hospitality. And Monday through Saturday, they're not available as much. But on Sunday after church, they show up.
The focus group, we were able to get information from them that we wasn't aware of, and to actually hear from them. So that's been the most impactful one that it's been, because now we can go and do research and say, how do we help them help themselves?
The workshops, which allowed community to give their voice on matters that you know, entail either them, their families, or community. That activity itself, providing the workshops, the forums, I think that opened the door.
Anything that you're giving away, the people coming out for. Anything that they hear is free this, is free that, they coming out. So, because we've been fruitful in our givings, we've been fruitful in what we do for them. So I play bingo with the seniors and we give away money. So when it started out this way, that number has risen, and Aunt Irma, Aunt Annie M, and all of them, they want to come and see what's going on.
I was some in the streets because we're there like over and over again in this spot that, well, we traveled to a couple, we went to partner with some of the other community leads, but the most engagement was right there at our spot on Michigan, when we would just come out and barbecue. We called the DJ and play loud music and just have fun. And our 24-hour peace jam, we sat there 24 hours, all night, all day, just bringing people in to cook breakfast for them, dinner, giving the kids these bouncy houses and all kind of stuff we just do. We call everybody in that we knew to come in and help, 24 hours. And I say the engagement is better there is because everybody knows we're there and they feel safe.
The most sustained community involvement, I would believe, would be the food pantries. People are challenged and they're struggling and they're suffering from food insecurities. So whether I have the funds to go and purchase this, and I only have the funds to go and purchase a minimal amount, the food pantries that we're involved in with our community organization and some of our collaborative partners, we're able to assist with that food pantry, and that has been the most fulfilling of all. You have people that come through there that say, well, I've been coming and this is my last time because I got my foot on the ground and I'm able to jump and keep running right now. And then you have some people that's coming through the line and say, well, yeah, I'm coming through some struggles and I just found out and I'm glad that you're here. And glad that this is a place where I can come once a month and I can come in and these can supplement into the staples that I do have. So I would say that it would be the food pantries.
But our biggest event, I feel, is the March and Rally. So this is an annual event that students and staff at the schools, parents, communities, the police, the fire department, everyone gets involved. We have our seniors from high school meet our 8th graders from the elementary school, and they are greeting each other. They are participating in our passing of the baton ceremony, where we use our theme of Ujima. And so that is bringing everyone into the fold. Everyone is participating. Everyone is there. Everyone is excited. The freshmen are excited because they know that they're going to have their chance to participate in this program when it's their time, when they become seniors. And so everyone is just excited, and it just sets off the summer safety measures that we really want to make sure that we are having a safe community. Everything, of course, is always on the drive home of what we are doing and making sure that our community is safe. And we want to know that our students are going to do exactly what they need to do. And we need to let them know that they have the support from their school, from their parents, from the police, and so that they know that we are here for them.
But the thing that's sustained the most is having those events with the resources. Those resources got the comfortability that people felt trusted enough to come to those focus groups. So not only are they showing up and showing out for the community events, they're now showing up for the focus group because now they have that trust to come in and let us know what they want. They want to talk about what they want. They want to give us information. So anything that we do pertaining to resources, community giveaways, and or focus groups where they have a platform to talk about what they want and be comfortable enough, they're coming out. They're coming out.
Echoing the words of the incomparable Dr. Joyce Chapman, 6 regions, 1 Chicago.